Supervisor Supervisor Abe-Koga. I've got some feedback here. Jim. Okay. Current topics of discussion in the Almaden Valley include, can you hear me okay? Okay. Proposed SB 330 Builders Remedy housing developments in and around the Almaden Valley, including but not limited to Harry Road. Related is an update from Sacramento that SB 330 did not make it to the Assembly this year, making it a 2-year bill. Since the bill wasn't signed, it might not be currently in effect, and so an explanation would be appreciated. We've also heard collaboration between Santa Clara County and San Jose City is of interest in this area, because this area is composed of both unincorporated Santa Clara County and San Jose City properties. For example, the disposition of the IBM Almaden Research Center site, whose closure was announced in July. Though it's formally in the city of San Jose, both the building and its surrounding 700 acres, it has been a major area employer, so it does affect both organizations. Because I was privy to the PowerPoint you provided us for today, I know that you're going to be covering the county sales tax measure on the November 4th ballot, mental health care following reduction in federal funding, county efforts to coordinate multi-city efforts to address regional homeless issues, and repurposing vacant county buildings and land. And at that, I turn the mic over to you.
So much for having me. Good evening, everyone. It's a great pleasure to be here. I think the last time I was here was actually about a year ago. There was a candidate forum at that time, and I was able to participate in that. And it's great to be back this time as your elected county supervisor for District 5. As mentioned, I come from serving at the city level in Mountain View after 4 terms, and have really been enjoying and really honored to be able to serve as your county supervisor. District 5 covers 9 out of the 15 cities in Santa Clara County, starting from the north end of Palo Alto. I again am from Mountain View. We go through the West Valley cities, Cupertino, Saratoga, Los Gatos, Monte Sereno, and then into Almaden, and we have the majority of Almaden in the district. So it's been a real pleasure to get to know this wonderful community. Many of you, I was here on Saturday, actually, at the District 10 Leadership Council. So it's been really great to be able to frequent this wonderful community. So thank you for having me. I wanted to just also introduce Christine from the county, Santa Clara County. She is here to also help answer any questions you might have about the federal cuts that are affecting us locally as a result of HR 1, the budget legislation that was passed on July 4th. But I think I have some slides, and I'm going to try really hard to follow them. But I know that of big interest to many of you has been what we call builder remedy projects, SB 330 projects. And I wanted to provide an update. You probably know or more aware of this already, but I know a couple of the projects were of particular interest, Harry Road being one of them, and that was the 173 housing unit development. And this project proposal, the application was actually deemed incomplete by the county planning staff. And it went to the Planning Commission at the end of August, and the Planning Commission upheld that decision that it was an incomplete project proposal. So what that means is that it can be processed with the current zoning, which I believe allows for about 43 units, so considerably smaller project. We may see a legal challenge to this. And so we will continue to keep you updated on what happens, but at this time it has been deemed incomplete. Another project that is of interest, maybe of interest is to you, and I just got this hot off the presses as to where we are on the project, is the 18730 Vista Drive project. And this was for 4 single-family homes. One of the projects is, and then I believe it one existing unit. So 5 units would be, and one of those would be deed restricted as a low-income unit. This too was deemed an incomplete application and was appealed on August 22nd, and will be in front of the Planning Commission, I believe, at a special hearing to take place in October. So again, we'll keep you updated on where that goes. But we have had quite a few of these projects. I think we had about 40 of these SB 330 projects. Our planning staff has been going through each of them, and actually quite a few of them have been either incomplete or they have certain timelines that they have to meet, and some of them have not met those timelines. So the number is smaller now, and we'll continue to monitor the progress of these projects. And please feel free to call our office if you have any further questions, and we'll also keep you updated. We have a newsletter from our office that goes out every Friday, and we try to provide updates in that. So I believe my staff is here, Isabel Sanchez in the back, and she can help you if you haven't signed up for a newsletter already. Please do so. We'd be happy to add you to our list. So those are the projects that we have regarding SB 330, and I'm not sure in terms of state legislation if you meant SB 79. So SB 330 did pass in the last session. SB 79 is the bill that would allow for higher density developments within, I think it, if I remember correctly, 500 feet of any major transit lines. I think that's the bill that's been moving through the state legislature, and it may have been deemed as a 2-year bill. So that's been also of interest to many folks. It could change the character of many neighborhoods. And so that is now a 2-year bill. This week is the last week of the state legislature to get their bills passed by Friday. So if they don't make it this Friday, then they'll roll over to the next session. So let's see, we're going on to the county sales tax measure. So yes, as mentioned, in July, the passage of the federal HR 1, the often called the Big Beautiful Bill, has trickled down. The effects of it are trickling down to our local communities. And for the county, Santa Clara County and all the counties, as you may know, we provide safety net services for the community. So we take care, we serve the most vulnerable, and that in regards to HR 1, that the bill is well, now it's legislation, but it's cutting Medicaid, which is Medi-Cal in California, quite a bit of Medicaid funding, as well as what we call SNAP, the Supplemental Nutrition Assistance Program. So if you know, a lot of our communities have senior nutrition programs, CalFresh, it's often called, that program is also being cut. What that means for Santa Clara County, we're looking at about $1 billion in cuts of Medi-Cal, and 1 in 4 people in Santa Clara County actually are on Medi-Cal at this time. In regards to SNAP, the food nutrition program, about 133,000 residents of Santa Clara County are qualify and utilize senior or supplemental nutrition. So this is quite a significant reduction in our funding. And so our total budget for the county is about $13.5 billion. Half of that goes to our health and hospital system. We run 4 hospitals, Valley Medical being the largest. We just recently opened Regional Medical Center. And we also have 15 health clinics throughout the county. So $1 billion out of that 6.75 billion that we spend on our healthcare system is quite significant. And so we've been preparing for this and looking at ways of seeing efficiencies in county government in general, but also specifically in our healthcare services. Unfortunately, though, because this is coming quite quickly, we haven't really had the time to implement all of the changes that we'll need to do. We're still looking for what we can do to find more efficiencies. It's quite an effort. $1 billion is a large amount. So in August, we had our Board of Supervisors had a special meeting, and we voted to put an emergency measure on this November special election ballot to ask the voters if the voters would pass a 5 cents sales tax. This will generate about $330 million. So it's not the entire $1 billion that we need. We're looking at trying to close that gap with a 3-pronged approach. So this is one of them, the sales tax measure. Second is we are continuing to advocate at the state level to see if we can get state assistance. And yet we still will look at probably cutting $300 to $500 million out of the budget. And that's what we're working on. Our staff is working really hard on this. Our next few board meetings, we'll start to see some of the proposals and strategies that staff is going to present to us. So it's quite again, quite an effort. I've been in elected office 19 years now, and I've been through the Great Recession. I was mayor that time. And this is actually probably the largest deficit I've seen in my time. And, it's not so much our doing, it's the federal government and the impacts that the federal decisions are on us. So we are asking the voters if they would please support us. What this means if we don't have this funding is that we may have to look at closing hospitals or health clinics. The county runs 2 out of the 3 trauma centers in the area, the other one being Stanford. So trauma centers or burn centers are specialties that only the county provides to all of our residents, and we don't turn anyone away. So what that would mean is that some of these services will be reduced, and it'll impact, frankly, everyone if you are in need of these services. So we're looking at that. We also are looking at the impacts on public safety. I know that's been a big priority for our communities, and mental health and homelessness. And the reality is all of this is connected. Much of our behavioral and mental health services are funded by Medi-Cal dollars, as is our homeless population, as they need case management and special services. A lot of that also is funded by Medi-Cal. So it really does affect the entire community. I personally, I mean, I don't think anybody really wants to add more taxes, and it was a very difficult decision for me. I do see, as I've been in office for 9 months now, that there are opportunities for areas to, like I said, cut costs, reduce duplication of work, and expenses. And so I want to, and I'm very committed to making sure that the county does that, and we do our due diligence. During this discussion about the sales tax measure, I introduced us increasing our reserve policy. We have very little reserve or rainy day funds right now. And had we had 10% of what our budget is, we actually would have been able to fill the entire gap. But our reserve policy right now is more at like 2.5%, and we have less funding than some of our cities, like the city of Sunnyvale actually has more reserve money than the county. So I tried to introduce that, was told I couldn't at that moment, but that is a policy that will be coming back this fall. So I will do my best and work hard. And coming from a city, again, where we have to balance budgets every year, and also generate new revenue, that's another area that I'll be focusing in on, and something that frankly the county hasn't been used to doing and coming up with new revenue. But I hope to be able to use some of the practices and strategies that I learned as a council member at the county level. So that's a bit about the sales tax measure. Regarding mental health services, I don't know where we are. Okay. So just as I mentioned, these cuts will affect our mental health services, and of course that is an area that has been growing in need. And one area that I've been focusing the alternative emergency response. So right now we have a program called PERT, actually 3 programs: PERT, Trust, and MCRT. What these are when we get an emergency 911 call, and if usually the police would respond first. Now we have a special unit that has a psychiatrist that goes with the police officer. And so if it is an alternative emergency, so mental health emergency rather than a crime related emergency, we send the PERT unit out. This program was actually proposed to be cut, but it's a program that's very well utilized and our law enforcement really values, and public safety being one of my priorities. I've been working to try to save PERT. Some of it has to do with the city, and when we talk about city collaboration, quite a few cities are willing to help fund this program to maintain it, including I've talked to the mayor, and I think he's interested as well. So that's some area that I think we can work together on. And when we talk about collaboration, I'm very pleased. I know I believe Councilmember Casey may be joining later. We've had a good relationship. We met during the campaign trail, and I've had the opportunity to work with Mayor Mahan, primarily on transportation. We serve on the VTA board together, as well as the Metropolitan Transportation Commission, and we've built a strong rapport, and we actually meet regularly now. We have a regular call, and so we're looking to collaborate in areas such as mental behavioral health, such as public safety, and then of course I know he's been very focused on homelessness. And so I think in the past, and not coming from San Jose, I'm sort of an outsider, but I've been told that the relationship with San Jose and the county has not always been the strongest. But for me, I want to turn over a new leaf, maybe as an outside, bringing in the outside perspective and finding ways where we can work more collaboratively. So I am very much committed to that. And being as mentioned, I was on the cities association and president of that association. I really think the city county relationship is very important. During COVID, we, at that time, the board president of this board of supervisors got all of the mayors together, and we met every Saturday at 9:30 on a Zoom call to talk about COVID and testing and vaccination sites and everything that came up during that time. And that was a real, I think, a great opportunity for us to build that relationship. Since COVID, or since a lot of the COVID issues were ended, that call is no longer happening. But I personally have instituted a monthly call with my mayors of the 9 cities in District 5, including Councilmember Casey's office. And so that's my commitment, that we work together to address these issues, because frankly, these issues don't have borders. They don't stop once you're out of San Jose, or Mountain View, that it's really a regional effort and a countywide and even further regional effort. So I believe that that's how we need to address and tackle big challenges ahead. Um, so that's county mental health services. The good news is that there has been quite a bit of work being done over the last several years. And so we've actually added mental health beds, inpatient beds. We had a goal of 500, and I think we're actually on target to exceed that goal by 2030 was our original intent. I've been told that the need is about 1,000. So I have been bringing that up as how do we get to the next 500 so that we can continue to provide the resources that are needed for our community. And then we talked about the mobile response. So moving on to vacant county buildings and land. So that's something that I've discovered as I've been in office, and a strategy that I used at the city with my colleagues on the council and our city organization is that leveraging land that we have and the facilities that we have to provide to generate new revenue. So we have quite a bit of land. Like one area I look at is the county fairgrounds. It's 150 acres, a lot of it unused. And I think we need to really look at how to redevelop these lands to generate revenue, as well as to provide the amenities that our community is looking for. So in my city of Mountain View, we own quite a bit of land that we lease to frankly, Google is one of our biggest lessees, and we generated at about 15% of our general fund from leases and rents. So I look at that as an opportunity that we can probably implement at the county. The last item I wanted to talk a little bit about, and we've already talked about the county sales tax measure, Measure A. It was mentioned we have a assessor's election, and that was really what spurred the need for a November 4th, 2025 special election by county charter. We, as a board, we weren't able to appoint a new assessor when he announced his retirement. We actually have to hold a special election. So that was going to cost the county $26 million, which we actually did not have. But due to the addition of Proposition 50 at the state level, that's the redistricting measure, we're able to split the cost of the election, so that reduces our expense quite significantly. I'm not an expert on the redistricting measure. I probably know just as much as all of you do of reading what's been put out in the public, but those are the three items on this November 4th election, and ballots will be going out in less than a month. So please be sure to vote. Regardless of how you vote, I think we are very fortunate in this country to have that right, and I encourage everyone to take that right and please cast your vote. So I'm going to leave it up to there. I hope I didn't go over time, but happy to answer any questions you may have. Thank you so much again for having me. I will continue to come out as much as I can to this beautiful community. It's really, again, an honor and pleasure to serve. Thank you so much for that opportunity. Thank you.
Hello? Hello?
So that rules out a two-part question. Does it? Okay, sorry. On sales tax measure. So what efficiencies has the county identified? You mentioned efficiencies, and I'm just wondering, like, if there's efficiencies to be had, why hasn't the county gone after those in prior years before they're faced with a crisis?
In regards to our healthcare system and the hospitals, the county purchased Regional Medical Center, I believe a little over a year ago. And to be frank, getting that online has been quite a Herculean effort that took the entire organization to do. So we opened regional in April. It's actually doing quite well. We had certain targets in terms of how many patients, and then, of course, the revenue that comes from that. And we're ahead of schedule on in terms of regional medical's targets. So, frankly, had we not had this HR1 bill, we were on a trajectory of an upward trajectory in terms of revenue generation, frankly, that would have closed the gap. The healthcare system has been subsidized by the county's general fund over the years, but we were on our way to closing that gap, and then this has hit. So there have been measures the last several years. Frankly, the county has had a structural deficit, so they have had to make some cuts, elimination of positions. We have about 26,000 employees now been reduced to about 23.5 to 24,000. We're at a point where, and a lot of them, frankly, were vacancies. But we are now looking at actual positions that may need to be cut, unfortunately. And I'll say, as the council member, the last 7 or 8 years, economy has been good. And even during COVID, it was fascinating that we had surpluses, and I think we were all experiencing that. And to be frank, I think when we, have funding or resources, it's easy to somewhat maybe get a little complacent, and there's always need. That the challenge is there's always more need than there are resources. So when we have opportunity to provide more services, that's, I think, the tendency. But again, knowing and having gone through recession times, it's a cycle, and I know that. And so I personally think it's very important to be diligent and putting money away every year, whether it's lean or good times, just to have that discipline, and in the same way, continuing to look at ways to be more efficient. So it's a change. To be frank, a lot of folks, I've been doing this a long time. I've seen those cycles. The folks who've joined and become on elected boards, it's new. It's a new world. And so I think it just takes some time to adjust. And that's where we are right now. Unfortunately, this HR1 is not giving us a lot of time to adjust. It just kind of hit us right away. Thank you. 2. Oh. No.
Hello, can you hear me? Okay, I have a specific question about a building plan, actually 25046, which claims to be approved under SB 330. And this is on Hill Lane, and it's a proposal that one of our neighbors wants to build 4 houses and put in the street right here off of Hill Lane. And this is a multiple listing, and it says that the location is in city limits. Yes, so it claims to be in city limits, and it says that the building status was approved, and yet the house is in the county, and all these houses are in the county. It's not in the city, and the multiple listing is basically blatantly saying things that I don't believe are true. So I was going to ask George if it's actually legal to have a multiple listing that's illegal or that's not truthful. And has this plan been approved or not? It's a binary answer, yes or no. And is it going to be approved by the county or is it being shifted into the city?
Yes, thank you. So this is the project near Hill Lane, the 18730 Vista Drive project.
It's on
And
Hill Lane. yeah.
okay, I think we have it listed as the Vista Drive address, but it is the same project. We checked, and you're right. It's listed as approved on the MLS listing, but it was the application was deemed incomplete on April 4th of this year in 2025. So it has not been approved. And in regards to the listing, that's actually under the Department of Real Estate to address in terms of the MLS listing, but the project itself has not been approved and it is under the county's jurisdiction.
And so is it mean that it hasn't approved? Are they trying to get it reapproved or?
So it actually hasn't made it to the Planning Commission for C projects. They had to get their application in and it has to be complete. And the planning staff deemed the application incomplete. So there is a certain timeline by which they need to have a application. I believe that the time frame is still open, but they have not yet submitted a completed application.
So it is in the county and it'll go through the county approval process, not the city approval.
Yes.
Okay. My only other comment is if they're going to build, I thought there was 700 homes down on Harry Road and now you say it's now 43 homes?
Yes, so that was another proposal that the application was not complete. And so, and there's like a time deadline that I believe has passed. So whatever proposal comes in has to follow the current zoning requirements. And that right now, that parcel is zoned for 43, up to 43 units.
So my concern is that with Almaden Research Center, the IBM Almaden Research, which used to provide over 1,000 jobs in this area, all these houses, where are these people going to work if we don't have jobs? I mean, that's a serious concern. And I know that you're going to say, well, that's a city problem because that's across you throw a ball and it goes from the county to the city. But that's why I was hoping George was here to have you guys speak together on the same stage. But what's going to happen if we don't have the jobs to support all these houses?
Yes. So this is all a part of what we're required to do. I'm sure you're all have heard of the housing element. The state requires every city and the county every 8 to 10 years to come up with a housing plan, basically called the housing element. Those are based on a bigger plan for the Bay Area. You may have heard a few years back, we have a plan Bay Area, and they do it by year. It was 2040. Now we're at 2050 plus. So every few years, that bigger plan is reviewed, and the plan looks at the projected growth of jobs, and then the need for housing to complement the job creation. We've actually been discussing that. I serve on the Metropolitan Transportation Commission, which is part of approving the Plan Bay Area plans, and we've been discussing that the projections, frankly, aren't coming out as expected when that document was created. I think we had, I forget the numbers, but large projections for growth. And we've seen over the last few years, I think mainly through COVID, that growth is not happening in this area. So how that will change, I think that will be and should be under consideration when we look at the next iteration of this Plan Bay Area and then the next iteration of the housing element. So it's hard, frankly, right, to project or predict what's really going to happen. I don't think anyone expected COVID to happen, and COVID has certainly changed things drastically. And so we need to adjust to that.
And hello? Okay. Yeah, just a comment on the that MLS listing. It does state that the plans are in the final process of approval. It doesn't say they're yet approved. So thank you for being here. On Saturday, I believe you mentioned that the Bay Area Quality Management District Air Quality Management District was going to be meeting in December. Is that correct, to discuss the electrification mandate, banning installation of gas water heaters in 2027 and gas furnaces in 2029. I just hope that when you guys meet, that you'll take into consideration how this will disproportionately affect low-income housing, seniors, mom and pops. You know, when a water heater or a furnace fails, it's an emergency. I mean, you got to get, you know, you can't be without hot water, heat, or air conditioning for weeks or months at a time. So I hope that you guys will take that into consideration. Not only that the cost of the appliance is the minimal part. The cost of the electrical upgrade can cost easily tens of thousands of dollars, money that people don't have. So I just hope hope you guys will take that into consideration. And I would urge everyone on the board to repeal the mandate. Thank you.
Yes, so I believe that is the plan. We did a review last December, so I'm expecting another review this September. I haven't seen the agenda yet, but that's my expectation. In regards to low income and the cost, I agree with you. It can get expensive, and that was my concern from the very beginning. I supported the original, and this is a ban of the replacement of gas appliances. So in 2027, there will no longer be gas water heaters available for purchase. And 29 is the expectation for other appliances. And so it's meant to be gradual. It's not like everybody has to go out in 2026 and replace their gas appliances. It's as you experience failure. In regard to emergencies, yes, that was an area that we've been looking at. Actually learned over the weekend that we have an emergency water heater replacement program. And so you can get a loaner until you can get the electric version. There's also a program. I have to find out more about who's offering it. I think it's Silicon Valley Clean Energy, but there is a program for seniors. Then you can actually get free water heaters, free advice on how to do the replacements. And there are quite a few credits, vouchers, subsidies, whatever you want to call it. So these programs are in place. I know in the city of Mountain View, before I left last year, we deemed this year the year of the water heater. So we're actually providing rebates and vouchers to get electric water heaters. So these programs are rolling out, and that was my expectation, was that we have programs to address these specific needs. And frankly, the way the rule is written, we can allow for carve-outs if there are just specific areas that are going to be very difficult to make that transition in. Yes, so definitely these are public meetings, and we encourage folks to listen, come in, provide your feedback and input. Yeah, thank you.
Hi,
Any
I'm
more?
number 4. Just wanted to feed off of that. My name is Therese Ferrara. I actually live in this area, and I live right back here. I'm one of the lucky ones who has a 125 amp panel. Not everybody does. People are 60, 90, 100 in that range. So I actually have a true case study that was done on this. And if I wanted to upgrade my panel up to a 200 amp so I could support what is coming down the pipe potentially, it's already a law, so it is coming, unless we are able to stop it or at least slow it down so we can catch up. It would $4,000 to $5,000 if I just wanted load shedding. if I wanted to upgrade to the 200 amps, so I didn't have to, run my dryer in the morning and run my whatever in the afternoon, for a 200 amp panel, $15,000 to $20,000, and 1 to 5 years for PG&E to be able to come out and dig, because I'm underground here. So 1 to 5 years just for them to come out to do that. So I completely understand with needing to be getting rid of gas and fossil fuels and all the things that we need to do to make air quality better. But this right now is not the solution. And we're just please asking you to revisit this. This is a real study. You could go get your own electrician to come out and do your home and find out that, again, I'm lucky. I'm 125 amps already. The only reason that I'm lucky is because I currently took out my gas or my electric range and made it gas. So I was able to reclaim 50 of those amps. So if I get into trouble, I might be able to replace my water heater. But what about someone who cooks on their electric? They don't have them. So that's just my, my experience.
Yep.
So it's like I said, I know we need it, and thank you so much for being here. I promise you this is not an attack on our part. It's just something that I did because we need to upgrade our air conditioner right now. So we're going through this right now.
Oh.
Thank you.
Thank you. I appreciate that. And again, yes, it's not one size fits all, and we see that, we understand that. So I expect that there will be some what we call carve outs, some exceptions. And again, we have to. So it was a rule that the air district is able to make regarding air pollution matters. We said that we would revisit this rule in after the study. So in probably in end of 2026 next year, I do expect it to come back to the air district, and based on what we hear, we can and we created this off ramp, so we can delay it. We can provide carve outs. So there are still options and opportunities. Again, I know that it's not going to be easy for everyone. I think, part of my reason for voting for it was that the market was saying that, they're ready. And I do see that there are more products. There is a 120 volt water heater, electric water heater available now that wasn't available 2 years ago. So that's what we're seeing, is that the technological advances are happening, and it was a really way to try to encourage that. So, but yes, so stay tuned. I would say please provide your input to the air district. We take everyone's comments very seriously, and we'll try to address as many of the specific issues as we can. Thank you so much. Anyone else? Anyone else have numbers? Oh, okay.
Yeah, we have some questions from Zoom, and I'm going to ask three quick ones. And there will be more. Regarding Measure A, if this proposed tax is to help the community hospitals, why isn't it a special versus a general tax? Special tax means that the monies generated go 100% to the destination, and of course have a higher voter requirement.
Thank you for the question. It's not a special tax. It is a general tax. So even though we're talking about the healthcare system, because that's really primarily where we're getting the cuts, it will be going to other programs. And if you read the ballot measure language, and we had to go to court on that, there is inclusion of public safety. That's a top priority. So it will assist in the other programs that the county offers.
Second question, the questioner has noticed increases in injuries and automobile accidents after the speed limits went up at the Almaden Expressway.
Mm-hmm.
Is there any study or plan to reduce that and reduce the speed limit in the interest of public safety?
I don't know right now. I'm happy to look into that and inquire with our staff and get back to you. The speed limits are tricky. There's some state law that doesn't really allow for us to, they give a range on speed limits. So it's very hard to enforce, frankly. But I will say that I have voted in my city to reduce speed limits after doing studies. So it is possible. And, I think, yes, speed does have a correlation with injuries and accidents. So happy to look into that. And if we can get the contact, or maybe what we'll do, if it's okay, we can send any of the answers to any of your questions that we're not able to answer today to you, Jane, and we'll ask you to get it out to our
Okay.
attendees.
And then
Thank
the
you.
third for this group of questions, can you share the reasoning for the replacement of the existing chain link fence around the old VTA park and ride site at the corner of Almaden and Camden, which the person thinks is a county parcel? The new fencing, it seems to be similar, but is now shaded, so you can't see, let's see. So you can't see people coming in. You can't see inside when you're driving by. What's the purpose for that kind of shading?
I don't know, again, off the top of my head, so happy to look into it. I know that some of the parcels, the VTA park and ride parcels, are being redeveloped into affordable housing developments. I don't know if that's one of them, but that could be it, in which then they do fence off the parcel. But happy to look into why that change happened, and we'll get back to you.
Great, thank you.
Thank you. Thank you.
We'll be back.
All righty. Oh.
Okay, I'm going to switch back to housing.
Yes.
In California and in our area, we have a severe shortage of housing. So actually, I'm surprised about the comment, where would people work if we had 43 homes out there? As many of us know who have offspring, couples are making $350,000 a year and cannot afford to buy in Almaden because we don't have enough homes. So my question for you is, I know there is a decision by the state to demand a certain number of homes that each city, county, produce. Do you know if we're on target to meet their requirement so that we don't have to undergo the builder's remedy projects? Are we on target right now to meet our projected number of homes so we don't have to continue to see builder's remedy projects that we're facing?
Yes. So the builder remedy projects were a result of the requirement that the housing element, so the
Yep.
plan,
Yep.
was
15.
submitted within a certain deadline. Frankly, no city met that deadline. Mountain View, we were actually on target to meet it, and
You've exceeded it. I read today. You
yes,
exceeded
our
it.
numbers, we've in terms of building units, we've exceeded the past housing element, or we call them RENA numbers, our requirements of how many units of housing do we have to build within, or to allow the building of within a 10-year time span before the next housing element has to be done. This last round of the housing element process was very different. They frankly have clamped down on cities. So it took cities much more time to get their housing elements approved. And so we're actually 2.5 years into this housing cycle. The expectation is that, and it's a little still vague, but the expectation was for cities to allow for that certain number of units to be built. But in terms of actually building them, that's not really the city's ability. Like the cities don't build housing. Frankly, developers build housing. The city's role is to make sure that the housing can be developed and there's land identified for that. So that was the housing element process. But now, frankly, I've seen it in my community with the economy, with high interest rates, financing has gotten challenging, and we're not seeing housing development proposals right now. So I think that's what's to me, I've done 3 cycles of housing elements, and what I've seen is missing in this whole process is the element of the market. And it hasn't been consideration of that. Like, we don't control the timing of when housing is built. It's really, when the market allows for it, when it's financially profitable to do. And I think that's the bottom line and problem with our whole process of
Right.
building.
And there might be some issue with how clear you are on what the proposals need to be, because you
Yes.
just mentioned two who submitted them,
Mhm.
obviously put a lot of time and money into it, only to find that someone told them they didn't meet the standards. So if we really want to get something built, we need to make sure the standards are clear, the builders understand them, and we get rid of the impediment to building. So that'd be my thing.
The builder remedy was that whole process was, I think folks have called it like a loophole. So it was because housing elements weren't making their deadlines. The developers had a period of time until those housing elements were actually submitted and approved by the state for them to get whatever projects they wanted to get without much regard for what the zoning is. So to close that, the cities had to get those housing elements approved, and now all of the cities in the county have approved housing elements. I think what's going to happen now is that the state's going to monitor each city to see if we're on track, and if they see that a city isn't or the county isn't, they do have the right to decertify those housing elements, and that opens up the so we have to be diligent in making sure that we're on target. But, I'll say for my city of Mountain View, 80,000 people right now, our number building was 11,500 units. And we have a total of, I believe, 40,000 units. So that's another 25% increase that they're expecting us to build in. Now it's 2030 is, I believe, 31. So in 6 years, like, is that really going to happen? No, it's not. And to be frank, most of these, housing elements in the past have not actually come to fruition. And so I think that's going to be something the state's really going to have to look at carefully to see how realistic this all is. That's just my opinion. Thank you.
Margaret, I just want to say that I voted for you for a reason. And the first time I heard you at the joint meeting with George, at this point, I thought perhaps with her background with the city and her success, she would be willing to collaborate with the beast that is San Jose, which we are different than Mountain View and all of the others that are under your district. And that's the one thing I want to encourage you to continue on, and how critical it is when we talk about the implications for HR1 and the number of people who will be off Medi-Cal, the number of people who will be impacted, or food. We know that we have a tremendous homeless problem as well. And so that implication is significant. You talked about looking at county buildings that are unused and just sitting there, empty. And it's the same thing that I feel when I see homes that are just sitting, and then I see people who are homeless in that area.
Yeah.
You talked about how you had been able to revenue repurpose those. And that's a good thing because you need money, but we need homes more. And so getting Google to put it into part of their campus, or Apple into part of their campus, or etc., is good. But are any of those discussions for the county buildings focused on turning them into housing or some form of shelter that we can offer? Because I fear that this number is going to go up.
Thank you. Yes, I think, frankly, everything's on the table. And in regards to housing, the county actually has used quite a few of their parcels for affordable housing projects. I think many of you remember Measure A 2016, the housing bond measure that passed and provided $950 million of funding for affordable housing development. The goal for that bond was 4,800 units. We've actually exceeded that. We're on target to build 6,600 units. So those have become online. They're in the process of coming online. I guess the beauty is that the $950 million is expended. On the plus side, the downside is it's been expended. So we need to figure out new sources of funding for affordable housing projects. But yes, the county has, and I've asked for the list of our available parcels. And so, not every parcel is going to be revenue generating. There's many different uses, right, that we can look at. So I think depending on the appropriateness of each parcel, we can decide what the best and highest use of it is. And so I'm very much open to affordable housing projects and homelessness. I've dealt with homelessness in my community, and I went out with our police officers and actually visited mostly, we have vehicle dwellers, RV dwellers, quite a large population of them. I went out and visited them, and what I discovered is that it's a very diverse population, just like the general population. Frankly, I had Google employees who are making $200,000-$300,000, but don't want to pay for an apartment, and they're living in an RV. I've had folks who just couldn't afford to pay their rent anymore. Families in some similar cases, folks who are re-entering the community. Maybe they were in our jail and prison system, and they're coming out and trying to start over. So it's a very diverse population, and what I've discovered is we have to try different strategies. There's no silver bullet. There's no one size fits all. Again, we have to look at the different circumstances and meet folks where they are and provide the appropriate strategies for them. So that's my way of philosophy on how to address our homelessness situation. So it's safe parking lots. We have the Mountain View, we have the largest safe parking lot program in the county, our tiny city. It's transitional housing, it's permanent supportive housing, it's BMR, below market rate units, and we built a teacher housing project just recently that opened, and then it's continuing to build housing, just market rate housing as well. So we have to do all of those strategies, I believe, to really address the issue of housing affordability.
My comment or question is, okay, my question is about the speed limits, specifically on Almaden Expressway. Our way over here, we were passed by somebody going at least 70 miles an hour. And that I know that street has been the site of many terrible accidents along the years. It seems like it's gotten more busy. Everybody's driving faster and faster. Our grandchildren need to cross that road to get to the store, get to school occasionally, and it's dangerous. And I know the council member Casey was referring. Somebody asked him about that when he was here. He said, "Oh, that's a county road. We can't do anything about that with the city." Can you please tell me why that road that's now basically a city street in the middle of a very busy residential district, it's not an expressway. It needs to be a residential street, and the same speed limit, maybe 40 miles an hour, like Blossom Hill Road, Santa Teresa, they're 40 miles an hour. People drive at least 60 miles an hour down that road all the time. It's dangerous. Please get it changed.
Thank you. Definitely we'll look into it. Also, I know the city of San Jose is approved using the readers, the speed readers. The county, we just passed the implementing the ALPRs, the automated license plate readers, which is not for speeding, it's for other cases. But I think that is something that we should be looking at, is how do we use technology to help us with some of our services, enforcement, I think the challenge, frankly, is that it's hard to get enough police officers and deputy sheriffs. It's always a challenge hiring enough folks, and to be frank, paying for them. And so we need to just, look at technology as helping to supplement and help us provide the services that we need to provide. Yes, so I'll definitely look into that. It can be changed. Again, it is challenging. The state has very specific laws that make it pretty hard, lots of hoops to jump over, but jump through. But, definitely happy to look into that. So as you said, it's 40 miles an hour limit right now. It's 50. Okay. So we can, yeah. Oh, okay. Yes, we can look into that too. Yeah. Got it. Oh, okay.
For Zoom questions,
Yeah.
you mentioned vouchers for water heaters earlier. Would those be income-based or have some other acceptance criteria?
Yes, so there's a number of different programs, and again, I'm happy to, we'll have my office look into them and provide the different programs that are out there. I believe a lot of them are income qualified, but like the one in my city, I think we're just handing out water heaters, frankly. So, or, some rebate to get a water heater. So happy to do some research and get to you all the different resources that are available.
Okay, another one is, can you please speak to SB 79, Abundant and Affordable Homes Near Transit Act? A key aspect of this bill would enable more housing development near public transit stops within 1/2 mile of current or proposed bus stops. And could enable multifamily housing under those conditions up to 4 to 7 stories. So basically, most single-family homes, because they're within 1/2 mile of a bus stop, could have a 7-story building next to them if the property next door is purchased by a developer. So the questions are, what is your take on this bill? And would you take a stand with your fellow supervisors to write a resolution, perhaps partner with other Bay Area cities and mayors, councils, et cetera, that have made similar types of resolutions?
Yes, so SB 79, we talked a little earlier about it as well. Senator Scott Wiener introduced the bill that would allow for higher density development within, thank you for the 1/2 mile distance of a major transit station stop. So it can really drastically change our communities. And when I looked at like my community, I live in downtown Mountain View and within 700 feet, I believe, of a our transit hub. It can be quite a drastic change. And for me, well, I don't support SB 79. I believe I appreciate the intent, but coming again from a city, I believe in local control. And what I mean by that is that we have as cities, we really understand our communities best. And the way we've been able to do it, and I appreciate someone saying like in Mountain View, we did overproduce because our community has been supportive, understanding the need for more housing. But the way we've been able to make it acceptable, I believe, is that we've been able to really focus on design, where these units and these developments are placed, that it isn't intrusive to the existing communities. So they need to fit into the existing neighborhoods has always been my philosophy. And you can really do that with good design. And so I don't believe in a 1-story and then suddenly a 7-story next door. Like what we've done is we call it feathering. We do gradual step ups. And so something like this bill wouldn't really allow for that. And I think that just makes it very difficult to be accepted. So for that reason, I think it is important to allow for, cities, the community to have more local control. In regards to resolution, I'm happy to look into that. I'm not sure where my colleagues stand on this bill, but we can certainly look at that. Thank you.
My turn. So let me start with some good news for the people who are concerned about the electrical heating panels, the electrical panels. You really don't need 200 amps or 400 amps, I heard recently. We have a 100 amp panel, we have an EV, we have electrical heating, electrical cooking, electrical AC, and it's just fine. And we could even easily add the electric water heater to that. So that's a good news. You hear a lot of people, oh, I need this upgrade. It is indeed very expensive. But I also suspect a little bit that there's some electrical contractors trying to sell you something that you really don't need. So be careful, get a second opinion. And if you have any questions, I'm more than happy to let you know why we get away with what we have, because it's just works very well. My question was really about the housing project. That's a question for you, obviously. Does the community really have any voice in this matter? 173 homes, changing the nature of the community. The way people talk about it is entirely transactional. There's law or regulation, ABC here. But at the end of the day, the people who live here are concerned about how this might change the community. People here understand that people have to live somewhere. I think that's very clear. But right now, this whole thing seems to be going down. There's just a builder's remedy. Seems to be a boondoggle for developers who, under the guise of affordable housing, just get their projects approved that previously would never have happened because of zoning laws and other policies, like I think the Almaden, there's some name for it, the expansion area, that was a 40-year moratorium, and all of that just seems to be cast aside, and people had this, anything goes right now. So I just really want to understand if the community has any voice in this.
Thank you for that question. I will say, in my time, I've seen the erosion of local control, and the state has come down with a lot more housing laws, requirements, restrictions on cities. The challenge that I've seen, and frankly frustration oftentimes, is there are unfunded mandates, and they require cities to implement things and no resources to do so. I would say that's the case with affordable housing at the end. And I've had questions. It's not, frankly, hand in hand, building housing just straight market rate versus building affordable housing. The market isn't going to build affordable housing that much. Like, we can usually require, inclusionary zoning requirements at 15%, but we've been told anything above that, market's not going to be able to pencil that out. So we can't. I mean, we could, but you're not going to get anything. So that's the issue for me, is that, frankly, with affordable housing, if the market's not going to do it, who's going to do it? It comes to the government, and that takes resources. And the state has not really provided the ample resources that are needed to build affordable housing. And so that's really the challenge I see. Also, and I'll say on the other side too, affordable housing units, they're not that much cheaper to build than regular units. It's about $1 million a door in my community, and that's a lot of money to find to build affordable. So we need to look at, and I know the mayor has talked about this too, about how do we make it less expensive to build affordable units. We've looked at things like modular units, and there's new types of builds, and that's something that I would need, when I have more time, I'd like to look into, is, how can we allow for different types of developments, different types of housing to be built, so that it is less expensive and we can build more quickly. So in terms of, yes, community input, I definitely feel and see the frustration. I've seen that change. The state is trying to take more of that control from us, because I think that, they think that we haven't done a good job. Again, my issue with that is that I think cities, especially this round with our housing elements, we have some really good documents now, but like we spent 2.5 years coming up with these documents, and they give us 10 years for the whole cycle. So in 6 years, again, how are we going to build, 11,500 units in 6 years? It's not possible. So I'd like to see that cycle being extended. We need more resources for the affordable housing piece. So as I mentioned, we can do inclusionary zoning at 15%, but what the housing element requires is about 42% of these units to be affordable. So my question is, where's the other 27% going to come from? And so, that we need the resources from the state, the federal government to be able to really build affordable units. So, but I'm sorry, going back to in terms of your, hearing the community, like I think it is still important to, and what I do is I encourage folks to talk to the developers early on, because oftentimes you might see a development is happening, but if you get your input in early, the good developers will adjust and try to incorporate. I know it sounds kind of weird, but I've actually seen that happen in our community, and the good developers will incorporate public opinion, and that's actually makes it easier for the councils to, or the planning commissions to approve those projects. So that's where I encourage the input happen early on and to engage with the developers. And when developers come to me, I always tell them, go out into the community and make sure you talk to the neighborhood associations and the various community groups so that they get that input beforehand. But yes, it is a lot more difficult now. I don't know the school boundaries, so we'd have to take a look at the map to see which school. And school districts don't follow city lines, right? So it's a little more complicated. So we'll have to look at where the parcel is.
Okay, I think that might be the last one.
One more.
And I got round two.
Okay, well, go.
So
Right.
regarding the gas appliance ban, I mean, it seems to the casual observer, when you look back in 2023, when this was first approved, that the approval was based on not good economic information about the cost that it was going to incur, that people are going to incur, right? Homeowners, panels, whether they have to replace them or not, right? But they're being forced onto 50 cents per kilowatt electricity, right? In some houses around here. So extremely expensive electricity. You look out 5 years, PG&E electricity is probably going to be much higher than 50 cents a kilowatt, right? So if you look at the last several years, how it's grown. So you're forcing everybody onto electric, and you're talking about cost of living problems here in the county. Well, that's creating them, right? That's creating cost of living challenges. And for landlords that own buildings that are forced to go electric, they're going to pass those costs right on to their tenants. So the low income people, the people that we're trying to help make more affordable living, are actually hurting them. So my question is, when these things are discussed in the Bay Area Air Quality Management District, are we getting the right information for you guys to make decisions on this from, and who does it come from? Does it come from economists, or does it come from staff on the air quality district? And are these staff economists? Do they know the downstream costs that they're proposing to put on the population? And so that's my concern. And I think there's a trade-off here, right? Between 85 premature deaths annually and $890 million in health impacts, which was, I think, the justification for this in 2023 to avoid these. But that's like a finger in the air guess. Is there science behind this estimate? And is there trade-offs being made? Are we actually, and this is the question, I guess, are you guys making trade-offs on how much cost of living you're adding to the county versus what this supposed benefit is going to be from reducing nitrous oxide?
Yeah, so when we first looked at the rule and voted on it, there was quite a bit of extensive study done, including from economists, from scientists, from the healthcare world. So we did take a look at all of that. Again, when we voted on it, it was with this off ramp. So it was really just, to me, putting a stake in the ground saying, okay, let's move towards this effort. But to be honest, I didn't know at that time how the world would change. And that's why we're doing these studies. That's why we're doing these check-ins. And we will have another check-in before 2027 when the rule is supposed to be in place. So I think like we gave ourselves a little bit, room to be able to adjust unfolded. And so, yes, that was really my thought, was that let's move forward, but also let's look at what's happening, and then if we have to adjust accordingly, we will. But with this, we have a working group of folks in different industries. Economists have provided us presentations on the economy. So we are looking at as many aspects as we can.
And we have the last question of the evening is going to be from Zoom. And it's rather broad, but it brings up things I think have not necessarily been mentioned in the earlier questions. So I think it makes a good kind of sum up on some parts. Can you please address how the needs and challenges of the current residents of this area will be met with the proposed additional housing in the area? Such challenges include high fire, let's say I lost it here, include high fire risk, minimal evacuation options, limited water supplies for some, limited transportation and for others, cell phone reception spotty to non-existent in some areas, traffic issues, internet is already not great in the county areas, some of the county areas. The post office is working overtime to create, and let's see, sorry, I can't scroll this very well. There's the new housing would squeeze animal paths in through housing areas rather than the open spaces that they do right now. Can you address this kind of larger impact of this kind of housing?
That's a lot to address,
So
but
I saved it for last.
I think that maybe just the general comment is that yes, housing is we need more housing, but again, I think what's really important is where it is, how it's built. I mentioned design, and then all of the impacts. And with the SB 330 projects, there is an environmental impact report that is required, and that's where we can look at all of the impacts and how they can be mitigated. In most cases, they are mitigatable. There are times when they're not. And I think that's when we have to really decide if a project is appropriate or not. So it's that process is still in place. I will say it is getting harder to have that kind of discretion. But with growth, we just have to plan accordingly. And as I mentioned, I'm on the transportation boards, and we're talking about how we can improve service. Frankly, with growth, the positive with growth is that you do get more revenue. You get ridership opportunities. There's something about critical mass. In my neighborhood, we wanted a grocery store for very long time, but didn't have enough residents, frankly, to support it. We now do when we have a grocery store. So there's benefits to growth and development too. I think the challenge is that as a community, we haven't really done a good job in showing that. But if you go to other parts of the country and the world where there is more density, that's where you're going to get better bus service, better transit, again, more retail. And so I think we just need to show that there are benefits to growth. And frankly, for a community to thrive, it does need to grow to some extent. I see communities that have just decided we're not going to build anything. We're not going to build housing or commercial, and they're starting to wither. School districts are losing kids because, and yes, there are school districts that are closing schools. Yeah. Yeah. So I think, yes. So there's, pluses and minuses, and it's really trying to find that delicate balance that, frankly, that's our part of our job. With the input of all of you as our residents. It's a tough job, I'll say. But hey, that's what we're elected to do. So, I appreciate the challenge, and I appreciate the opportunity to work on these issues. So thank you very much. I think time is up, but thank you so much for your patience. I appreciate all the incredible wonderful questions, and look forward to continuing the dialogue with all of you. Thank you.
Actually, I'm going to take the MC's prerogative and ask one more question. Rodents. Yeah. And the reason why I asked this to a county supervisor is rodents don't know the boundaries between cities. Seems there's been quite an increase in rodents in the county. Ground squirrels, black squirrels, rats. Is the county vector service or some department of the county taking any measures to address this? And can residents take advantage of any programs in place?
Yes, we do have a vector control department. I don't know off the top of my head again all the programs that we offer, but again, happy to provide that to all of you. And yes, we've noticed that. I was just talking to a neighbor about rats and dead rats in the big crawl space. So there does seem to be an increase in rodents in the area, and I don't know if it's the scarcity of food and water that they're experiencing that's bringing them in to our neighborhoods, but certainly that's an issue that seems to be growing in interest. So happy to, again, we can provide you that information of what our vector control department does. Oh, OW. Oh, okay. Uh-huh. I'm happy to look into it. I know I'm not very familiar with the owl boxes, but we can definitely provide you information on what's allowed too. So thank you again, everyone. Have a great evening.
Thank you, everyone, and we'll see you the second Monday of next month, the 13th of October, to meet the candidates for our county assessor position. Thank you and good night. Thank you.